Hello friends, welcome back to my channel and thank you so much for liking and subscribing to the channel. So yes, in the series of guest interviews, today it is our episode 17, and as friends I always keep saying that parenting is like a lifelong project and we need to be very careful and very aware of everything while molding the child. Earlier days people had many kids and they didn't even knew how the kids just grew magically with the environment that they had around them, and even siblings used to take care, family, people, neighbors, everybody used to take care in raising the kids. But these days even taking care of a single child has become a very, very challenging thing due to the various kinds of new generation problems, either be it physically or mentally. And I feel major reasons are the climatic changes, the food habits, and how we can forget the most favorite thing, that is the gadgets that we have these days. So yes, to tell us more about the issues related to mental, emotional and behavior disorders of the child, today in our podcast we have Dr. Ravikanth from Hyderabad, who is a child and adolescent psychiatrist with an experience of 12 years. And I'm very happy to say that he's the only DM super specialty in child psychiatry in Telangana. And he has helped many kids with autism, ADHD, intellectual disability, depression, anxiety, disorder, and all other mental health issues. So yes, sir, welcome to my channel.
Yeah, good morning, ma'am.
Good morning, sir. So yes, sir. So first, I would want you to tell us what is the difference between normal psychiatrist and the child psychiatrist. Like we know, like people approach to counselors or psychiatrists with their issues. Why can't we take the kid also to the normal psychiatrist? Why do we have to specifically go to a child psychiatrist?
Yeah. So we as a child psychiatrist, we diagnose the medical health issues along with the psychiatric problems, where the psychologist may be more familiar with the only psychological issues, but since we are trained medically, like we have medical training, we can rule out some medical causes which may mimic the psychiatric problem. Like someone is in depression, someone is in anxiety, but there's some medical reason behind it. So it's important for a medical doctor to first evaluate, diagnose. Once the therapy starts, a psychologist can take over the assessment part and the therapy. And being a child psychiatrist, we are trained exclusively in handling these children as early as 1 to 2 years, because the autism can set in so early on, till 18 and 19 years. So this is a very different group of population where their needs, their presentation, everything differs very much from the adults. Adults come directly with their problems. Children don't come. So the parents come and the children hide it, and or the children can't express it. Maybe through the play way, maybe through their observing the child, making a report from multiple sources. A lot of work needs, which is much different from adult patients.
Correct. So yes, sir, as you said, like right from age 1, you have kids coming. So the major issue now is how to identify that the child is abnormal, because usually I think by the age of 1, it's very common that the child does just some common activities and all. So how can parents identify that from the early stage?
Okay, so it's a very important question. Parents have this confusion whether my child, his behavior, like there are behavior which come and go. So all these behaviors need not be labeled as a pathological or a disease or disorder. Okay. So what we should see is if there is any behavior problem which is persistent, which is impairing their academics, their social life, their day-to-day life, that's when we should get it out. So when you get it out, instead of talking with alternatively we can talk with our pediatricians or someone whom the child is familiar with, like the teachers, and then gather some information, whatever you can, and try to understand if there is a clear-cut problem in their day-to-day life. And then if you have a doubt, meet a psychiatrist. And then our evaluation will help us, help the parents to understand what are the psychological issues. So anxiety, depression, all these things, may be seen as sudden change in a child's behavior. Like a child's routine is totally changed, their behavior changed, their emotions changed, or maybe their language regressed, or maybe there's a delay, or maybe there's a gap between how the child performs in various domains compared to other kids. So if there is any doubt, to meet a psychiatrist once.
Okay. So, like you said, the parents have to be very aware of the behavioral changes, because commonly what I've noticed is many parents ignore those changes. Maybe they might think that it is just development spur, or that slowly the child will develop. So what are the basic reasons that we can say is the reason behind autism or ADHD these days? Because one more doubt I have, sir. Why wasn't this there previously? Like, I think only around some 6 to 7 years, from 6 to 7 years, we are listening such terms, ADHD, autism and all. Was it there before also but couldn't be identified, or it has started only now?
Yes, this is an important question when why we are hearing these words, and even as a medical doctor, we didn't know what autism was in our medical training. So there are some reasons which can explain. One, possibly the autism was not diagnosed and they were subsumed under intellectual disability, previously called as mental retardation. That one possibility. Second is the kind of upbringing the parents are having with the family structure. So when we were kids, we barely had time to sit in front of TV or watch or something, and we always had time to play with other kids and interact. We used to play in mud and everything. So the point is, when the kids are restricted to home, especially after COVID, this has increased. They don't have enough stimulation, social stimulation. They barely see their parents and maybe one or two cousins once a while. So that stimulation is not enough. So we are seeing more cases because of this, that the lack of stimulation. Of course, excess screen time is also one important point, which is also indirectly linked to lack of stimulation causing autistic symptoms. So good thing is that a lot of kids who improved significantly after cutting down all the screen time and increasing the social stimulation. Of course, then therapies are also important, which should be, like, we can discuss that about.
Correct, sir. So maybe because of the nuclear families that we have these days, and both the parents are working, so even the child doesn't have any other option other than sitting in front of the TV or the phones and all.
Yes.
So yes, sir. So once the parent identifies that there is something wrong in the child, what is the next step that the parent has to take? Like you said, maybe they can talk to the pediatrician, and then how to select a good therapist, or to whom they should go and consult. Can you just tell us about that, sir? Okay.
So when you find that, for example, let's talk about autism or ADHD. So when you have that doubt, just start observing the child in various social situations. So if a child is not mingling much with other kids, not maintaining eye contact, and not responding to name call, so we should not assume that, okay, he is very playful, he's very active, and he's not bothered. So he should have some reciprocal communication, like to and fro communication, either verbally or non-verbally. So if that is not happening, the child is self-engaged, self-play, and least bothered, and only coming to you for their needs. So that is how the child is behaving. Then just in Google, you have something called MChat. You can just open the MChat for all kids who are less than 3 years. This is called MCHAT, MChat questionnaire for autism. So just fill up these 20 questions. You get some rough idea whether it is low risk or high risk. And then take this paper, meet your pediatrician, or to just discuss further more, and then meet a psychiatrist once recommended by the pediatrician. Or sometimes even you have a doubt, but pediatrician refuses to acknowledge that he has autism. So just take one consultation. Maybe that changes the child's life. Because if early identification happens before 2 years, then almost all cases improve, almost all cases recover. If the child is diagnosed at 3.5 or 4 years by the teachers, still the child will improve. But if the child is not diagnosed even after 4 years or 5 years, most likely they will remain to have autistic symptoms. So meet a psychiatrist, and also understand that you asked about the therapy, how to identify which therapy center is good, which therapist is correct. So you should understand, when you join the child in any therapy center, there are 3-4 rules. One, the parents should be involved in every therapy session. The parent should not sit outside and watch the CC camera, first thing, because they spend barely 2 hours in the therapy center. But what about the rest of 10 or 12 hours the child spends with the family,
because
the parents?
Actually, I've heard also, sir, from some of the parents that in some therapy centers, they don't even allow the parent to come inside. This is what I've actually heard from some of the parents.
In most of the therapy centers, they don't allow. Some therapy centers allow. I can say out of 100, maybe 10 or 5 therapy centers allow parents inside the therapy session, which is totally absurd, which is not right. Then second thing what we should see is you should know the qualification, like a speech therapist. Just Google what is a speech therapy qualification, what is the OT therapy qualification. It's MOT, BOT for OT. For speech therapy it is called BASLP, Bachelor of Audiology, Speech Language Pathology, and so on, Masters in Speech Language Pathology. And then for psychology, like behavior therapy, at least we want someone who did BA or MA, or BSc or MSc psychology. So nothing less than that. So if someone is for example, special education, we need B.Ed special education. So we cannot, for example, if you need an eye checkup, you don't go to ENT doctor. So the same way, if you want a speech therapist, go to a speech therapist, don't take a special educator's help. If you want an OT therapist, don't take physiotherapy help. Every therapist has their own expertise. And unfortunately, they do cross consultations. They treat they take up the therapy which they are not trained for. So don't go for like that. And also meet either if you want to get it diagnosed. I am not saying only child psychiatrist. There may be an adult psychiatrist who is experienced in it. There may be a developmental pediatrician. There may be a pediatric neurologist. There are people who can diagnose autism. But if you have any doubt, if the case is confusing, so always take second opinion. It's just a matter of consultation, right? And don't delay the treatment. Most of the therapy centers also one more thing, when you ask a therapist what is their qualification, they might not be interested. Like, I mean, they may not be revealing it. So always ask for an assessment instead of asking their qualification. Just ask that to give a proper written report with a sign and stamp. That's all. Indirectly you're asking their qualification.
Correct.
And the third thing is, for the therapy center, you must always ask them to set a goal, like short-term goal, long-term goal. It cannot be the therapist says, so give us time, at least 6 months or 1 year, we'll set the child right. No, that's not the right way. Always ask them to give the goal. What is your goal for next 1 month? What are immediate long-term, short-term goals? This is how a good therapy center should be chosen.
Right, sir. So, like you said, the goal. So, it is depending on the therapist when to stop the therapy, or even the parents can notice the changes and stop the therapy. Like, what is the exact period when to stop the therapy for the child?
Okay, so let's suppose we started speech therapy. So the end point is when a child is able to communicate what has happened, for example, in the school, or what is happening in front of him. If he's able to comment on those things, and he's able to make a full sentences without your prompting. You don't have to say. You just ask what's happening, why you don't like this, what did you do, so where did you go, what happened in the school. So the child is able to, even in a broken way, if the child is able to speak in sentences, then we can cut down the speech therapy session. So make it maybe once in a week or twice in a week, and then we can stop it. We don't have to indefinitely continue the therapy for next 3 years or 2 years. And one more thing, which is a wrong, like you see this as a red flag. If a therapy center is asking you to pay for entire 1 year and giving you concession, then they're actually locking you for 1 year. So whether you like it or not, you have to continue in the therapy. So don't go for those discounts. Wait. If you're very convinced about the therapy center for initial 2-3 months, maybe then you can pay for at least 6 months or so. But on the day when, if they're locking you for next 1 year, that's definitely not the right way. Don't do that. So this is important. Yeah.
Correct. So, sir, different types of therapies are given after, analyzing the child and evaluating where they are where they are lacking, or all the kids who are going through this problem with ADHD and autism, they follow a certain pattern of therapies. Like, are there different therapies for different issues?
Yes. For example, the child has motor delay, unable to walk, unable to grasp things and use his hands. So maybe he needs more of the physiotherapy and occupational therapy. See, many people don't know what occupational speech therapy is straightforward. Behavior therapy is straightforward. OT therapy is totally alien. Many doctors also don't know what OT therapy is. So, so let's talk about speech. Speech, everything is clear. Then behavior, behavior issues will be there, like anger, aggression, irritability, or not having eye contact, not looking at the direction which you are showing, the joint attention, and not imitating, not pointing. These are the things. Behavior means not only the abnormal behavior, behaviors which the child needs to pick up. So these are the behaviors which we want. Then comes the OT therapy. OT therapy has 3-4 domains. OT means occupation. So it's your daily activities which you are supposed to do. A child is supposed to play, interact, and use his body parts, and use the objects around him appropriately, play properly. So these things, even taking bath, self-care comes under the activities of daily living. And also sensory issues. There are some sensory issues like tactile sensitivity, hearing, like if the child cannot tolerate some sounds, or maybe seeking more sounds, running in circles. A lot of sensory issues will be there, which OT therapists can resolve with the OT therapy. And one more thing is, you can do home-based speech therapy, home-based behavior therapy, but OT therapy should be under supervision, strict supervision, because you saw the child being swung in a swing. You should not repeat it, or if the therapist is doing brushing, you cannot buy those brushes and start brushing the child. So don't do that way. Always do it under supervision. OT is very important, because if you do in a wrong way, the child will actually worsen. So you need a very qualified OT. And unfortunately, there are few OT colleges in India. There's no OT college in Telangana, in Andhra. So most of the OT therapists come from outside the state. So you need that OT consultation and OT therapy to give you a right homework to what you are supposed to do and what you are not supposed to do. Right? And then physiotherapy, of course, if the child has toe walking or any other gait issues, even visual therapy, if some cases. And one more thing, for visual therapy, there are therapy centers in Hyderabad which offer visual therapy for every child, which is again not accepted. So visual therapy is not needed for every child. If there is a visual fixation, or if there is a difficulty in tracking the objects, then visual therapy may be needed. Or if there is excessive sensory issues related to the visual sensation. So, and also special education. If the child is not able to read, write, this kind, or some bath, so these are the things which is toilet training, where special educator also is needed. So it's a total teamwork, multidisciplinary teamwork. Of course, there are other issues like some allergy. If the child has food allergy, we need a pediatric immunologist or allergy specialist. There are other like endocrine issues. A lot of other medical specialties may be needed, gut issues. If there is a seizure, then neurologist may be involved. So it's my job as a psychiatrist to make sure everything is integrated. But that's something which a therapist can't do all by themselves. They need medical knowledge for it.
Correct. And sir, other than all these mental and emotional issues, the major thing that kids are having is speech delay. I mean, usually they say either the child will talk by 2 years of age or after 4 years. So do these kids also need a therapy, or the parents should wait till the child comes to 4 or 5 years of age? Is it a common thing to be like this, or is this also related to some kind of mental issues? Because these kids will not have any other issues.
Any other problems,
related to their behavioral issues or anything. Just there will be a speech delay. So what has to be done in such situations?
Yeah, this is a very important question. So many people get confused with the speech delay and autism. So speech delay per se is expressive speech delay itself is not a mental health issue.
Okay.
So the many children, like they start speaking at 3 years, 4 years, 5 years. So it's totally okay. The thing is, if the child is not speaking by the time the child goes to school, then maybe the speech therapy should be started. Only speech therapy. And he should not be labeled as autism, because autism is not just a speech delay. It is a poor social communication. It's a difficulty in making back and forth communication, and then repetitive behaviors will be there. Restricted interest will be there. Sensory issues can be there. So the rigid patterns will be there. So a lot of other issues should be added up to call it as autism if it is only expressive speech delay. Like, how do you know if a child is through facial expressions, through gestures, he is able to communicate in a very nice way? It's not that the child is calling you by hand and showing you something to give. No, the facial expression should be lively. Just that you feel like, okay, if this child can speak, it would be great. Because the child is able to express everything, make friends, mingle with everyone, copy, imitate, even look at what you're showing. Everything is perfect. The only thing is the child can't speak. So that's not autism. You don't have to panic. The child will speak. He just we need to give speech therapy because it's not invasive treatment, right? It's just a speech therapy. So, and the parents should learn it so that they can do it home. It's just a matter of few months, that within 5-6 months, the child will pick up all the words, and maybe some mispronunciation here and there. That also will be corrected with practice.
Correct.
Yeah.
So yes, sir. So all the issues that we have discussed, are they developed like by birth, like when the child is in the mother's womb, from that time itself they have these issues, or once they are born later on with the surroundings and, like we said, the excessive usage of TV, telephones and all? So is it that way?
Okay. There's something called genetic vulnerability. Every child who is born will have some risk of genetic vulnerability for most of the common illnesses. So a child who is, today you're seeing at 2 years or 3 years, a child having autism, that vulnerability was started when he was born. Okay. But if that vulnerability meets with lack of stimulation when they grow up, so these two factors are important for autism to develop. But if there is strong genetic loading, in spite of your best stimulation also, autism can happen. So we are finding a mix of the picture, that most of the cases which we are seeing these days, they have mix. Like the child will have some genetic vulnerability. The brain will be programmed or wired to have autism, but he might escape if you are giving proper stimulation. So that's exactly what's happening. So 20 years back or 30 years back or 10 years back, we didn't, the number of cases of Down syndrome or other hearing impairment, visual problems, all these things which are also genetic, didn't increase so exponentially as much as autism. So autism, genetic vulnerability was there even previously. Whether like you, me, would have been autistic if we were giving no stimulation, no adequate stimulation. We were stimulated adequately, so we escaped. Now our kids are facing this problem today. So, yes, the child will be genetically vulnerable. At the same time, screen time and lack of stimulation also adding up. So, both genes and environment, both are causing.
Correct. So, sir, like you mentioned about the stimulation, what are the basic things or the remedies that the parents can do at home without consulting a doctor? I mean, if it's in a very early stage or very mild symptoms if they are facing, can it be handled at home with the help of parents or some adults? Yes.
So if some people, so whenever you have an option, always take a weekly or monthly consultation from a psychiatrist or psychologist, or there are some people called early interventionists. So these early interventionists are like either diploma or masters in early intervention. These people also can guide you what you are supposed to do at home. There are free resource materials available. There are a lot of YouTube channels available. There are books available where you can go through. And in simple terms, again, get connected to the child. Spend a lot of quality time with the child, play with the child, and don't wait till the child responds. So your stimulation is not should not be proportionate to the child's response. The child may or may not respond. You keep on stimulating, you keep on talking, commenting, play with the child. So, for example, I'll ask you a question. Okay, so if you means all the audience also think about it. So if we see these shows, right? Reality shows where there are judges and there are participants. So the participant will come onto the stage, perform for 2-3 minutes or 5 minutes and go away. It may be a song, dance, and the judge will sit and just judge, right?
Yes.
And the performance may go well or not, right? In this comparison, when you are doing a therapy with your child, is the child a performer or a judge? You tell me.
I think a performer.
So you see as performer, but see the paradox. Performer always comes with lot of hard work, and judges come without anything. Like they don't even know what the activity is. Now again, answer my question. Who is working hard? Who is reading books? Who is checking all the materials? Who is understanding all these things?
Correct. So parents are performing.
So,
okay.
Yes, if the parent is performing and the judge is not liking, your child is not liking it, so it's problem also with you, the performer, the parent.
Correct.
The parent should come up with better performance. So if you are trying to grab the child's attention to something, the child is not looking, maybe you should make it more interesting. Maybe your voice, the way you talk, you cannot talk like an adult. You should talk like a child. You see all the nursery teachers, how they talk with the child? They sing. they talk, they use colorful things to grab the child's attention. You should start doing these things at home, especially if the child is having some delay in social communication and speech. And don't get disappointed. So judge is always right and the performer is always wrong. Is that like how the umpire will judge?
Correct.
Same. Okay?
So yes, sir. So like you said, we have to talk according to the child. Here, I have a doubt. Suppose we are talking very calmly, very softly to the child, and also we are rewarding the child with something.
Yes.
Will the child not get used to this kind of behavior? I mean, how to again, take to the next level?
Okay, the reinforcement is a basic motivation for even us to work and for most of our day-to-day. So don't buy rewards. You just give natural rewards which our child already receives. It may be small nuts, it may be appreciation, pat on the back, singing a song, reading a book, or playing with the child. So the appreciation is more important. The social reinforcement is more important than the material reinforcement. And even if you buy something, it should be natural, like fruit or some nuts or something the child likes to do, rather than buying something outside, some junk food or something. And reinforcement should be given initially in a higher doses and gradually fade it out. So ultimately, your social reinforcement should be the only thing which you are giving, rather than always giving something to eat, something to drink. No. So you should fade it out gradually.
Correct.
Yeah.
Yes, sir. So also I have observed among many kids that they're very good with academics and they learn very quickly, they respond very well, but then they are not so calm, like maybe they are called as hyperactive kids, I think these days. That is also another term that is used. But is this also a kind of disorder, or is it just that the child is more active and the child is not sitting at one place? Though the child is doing everything perfectly, he's studying perfectly, writing everything, but that, we can say as a focus or that calmness is not there in that child. Is this also a problem?
Yeah, see, highly energetic kids who are very enthusiastic and active, we don't call it as ADHD unless there's some clear problem with the child. Like, child can't control his urges, he gets into tantrum modes very easily, pick up fights with people, and get annoyed easily, and this attention issues clearly showing that the child's potential is much better than what he performs. He cannot sit and write a simple a paragraph quietly. He cannot sit and play with anyone. He dominates everyone. He gets bored easily. He is into the gadgets excessively. So if we have this gray zone, meet a psychiatrist. Just meet a psychiatrist, a child psychiatrist preferably. We will get a better idea. We will do some assessments, basic assessments. Then maybe even if we do the assessment, it's not that we started them on medication on the day one. Unless there's a clear disruption in the child's life, we don't start medication. We give them behavior therapy techniques, strategies to be more attentive. Or it's not about marks. Maybe the problem is with the parents. They think that, okay, the child is getting top 5 or top 3, so I think he don't have ADHD. Kids with ADHD can be school toppers. So let me get this straight, that kids can perform very well, but if you are not making him sit and study at least for 20-30 minutes at a stretch, and he's growing up and he's now 11 or 12 years, now the academic demands are so high that he never had a habit of sitting. There are a lot of kids who study only before exams, and parents say he scores best. He's in top 5, why should we worry? The worry will happen later. Tell me instance of a student who is in +1, +2 or 10th and just sitting just before exams and getting good scores. It doesn't happen. You have to put efforts. The discipline is more important, not the marks or ranks. So I think getting assessed is important, and every child is not hyperactive, and every child will not be treated with medication. That's something I want to tell. And age also. A child who is just 2 or 3 years, we don't even call them as hyperactive or ADHD and all this. We'll wait. There's something called difficult temperament. A child may be very active but temperamentally, but later these things will resolve. ADHD is a disorder. Temperament is a normal thing. A child can be very active. It's totally fine.
Correct.
Yeah.
And sir, now can you please tell us about the depression and anxiety issues that the child is facing? Anger, depression and anxiety. I think again these are not related to the disorders, but these are just some emotional setbacks or the emotions that the child is showing. But like we parents, we think what are so big the issues that the child is depressed, and what is that big an issue that the child is getting angry. So what can be the reason for this, and how can we also stop this in the early stage without any medication or anything? How can the parents take care to avoid such situations?
Yeah. So your question has two subset questions. One is how to identify. Second, how to teach the child. Correct. So I'll explain, like anger, for example. Children who are depressed, young children who are depressed and sad, or they're anxious, they may not always present with sadness. Like when we are sad, we look sad. But kids who are actually sad or anxious, they actually show anger. They show irritability. So the anger may be because of anxiety, or maybe because of restlessness, maybe because of impulsivity, or maybe because of the modeling. They might be watching their parents, their peers behaving certain way, and they start picking up those behaviors. So it's not always that the child has a mental health issues. Anger is natural, first of all. So our job is to train them, teach them how to control the anger. But instead of teaching them, first modeling is important. If they are angry, if the kids are angry, especially teenagers, if they're shouting, yelling at you, and you are shouting them back, showing your full authority and control over them, so it will only worsen the situation, because what you are doing is the same exactly what they are doing. You are frustrated, you are shouting. So they are frustrated, they will also shout. So you need to be very calm and handle the situation slowly. Like later you can talk about it. You don't have to reply immediately. When the child is angry, you don't have to, you just try to calm him down. If he's ready to calm down, fine, make him relax. And if the child is calm, then you start engaging. Don't engage when they are actually very angry. There's no point there. The child will not be receptive to any advice that you're going to give. And depression, when the child, how do you know that the child is depressed? So other than this anger, irritability, you can see the child is not eating properly, is not playing, is not even the favorite game the child used to play is not playing anymore. So we may not want him to explain why is he sad. There may be some abuse happening, maybe something that he don't want, he's not comfortable opening up. So always listen, connect to the child. So instead of correcting the child, try to connect with the child. And for connecting the child, you must always be with open ears and mouth shut. You cannot keep advising them. Why are you taking so much stress? Why are you? I told you not to talk with him. So these are not the things that the child wants. A child wants a listener, good listener. So listen to your child, spend some quality time with the child. Every day, go for a walk, play together. Watching TV is not a quality time, for example. Correct. So, together watching TV or being passively waiting for something to happen in the TV. But here, I want some active process of talking, communication, even cooking together, anything. So these are the moments when the child will feel that connected, then feel that, okay, I can talk anything to my mom or dad. Today, whatever they talk, we bring that issue later. So, for example, child is crying or emotional. You say, why are you so emotional? What's wrong? It's just a normal thing. Why should you even worry about it? So instead of that, you can just say more empathetically, I can understand you're feeling bad, and we talk about it, and you discuss about it. And if he's discussing and revealing something, don't immediately stop or advise and start countering those points. So this is how you have to deal with anger. Of course, psychiatric help is needed. Whenever you have a doubt, instead of going through online solutions, YouTube solutions or WhatsApp solutions, or talking with someone who is near and dear and solving the problem yourself, just one consultation with a psychiatrist, maybe 50% of the consultations in such cases may end up understanding the child is having just some adjustment issues. It may not be a mental health disorder. Talking to a psychiatrist really helps. Right.
So, like now you mentioned, sir, about the smaller kids, like they want parents to spend time with them or they want parents to play with them. So, what are the major issues that are faced among the teenagers? You even deal with adolescents. So, what are the issues they are facing? Maybe lower marks in the exams or pressure from the parent side, or maybe their friends are not good to them. So, what are the major issues that teenagers come up with you, sir?
Yeah, teenagers have a very tough time. So I'll give you first understanding how I assess these children, teenagers who have some trouble. So there are 4 quadrants I draw for them. That 4 quadrants is SSFF. So S is self. Whatever they feel about themselves, maybe they're feeling underconfident, their look, their appearance, a lot of things. You may find them most very good looking, but they feel they're ugly. So their perception about themselves physically, these are things which are important. And their self-confidence and their self-esteem, all this. Second is the studies or any co-curricular activities. So they may be very stressed up with those things. They even getting good marks, they feel that they're not good enough. They should get better, because the attention which other popular guys, girls in their class, they too want it. So this pressure situation which they go through should be understood. And the other F is the family, and then another is friends. So definitely these two domains they struggle. At one point they get attracted to the friends and they feel the friends are right. At one point the same friends may abandon them and they have no one to talk to. And suddenly, and then the family. The family, most of the people like today, they're so busy that they barely get time to get connected to their teenagers. And teenagers are now, because in childhood they're not so well connected, some of them, they don't want any more connection with the parent. They want to see them as only, like a headache. They always complain, they always control. So that is important, that parents should not make the teenager feel offended whenever they get giving an advice. And when they're giving advice, it should be very short. And they should spend some time without giving advices. I mean, that family time which I told earlier, they should not be of any advice. You can bring up that later. But during that time, the child may complain, but you don't complain on the child. You just say, listen, okay, fine, I understood, and how can we solve it? So teach the child life skills. So if you Google life skills for teenagers or for children, even primary level school also, we have life skills, and they are freely available. CBSE has issued PDFs, free PDFs for all teachers and parents to just go through it. So these life skills are very important: how to communicate, how to solve a problem, how to maintain interpersonal relationships, how to cope from emotions, stress. Very easily you can understand anger management. So all these things are well written with examples. Maybe parents can go through this instead of reading some YouTube, watching some random movies and something. They can invest their time on this.
Correct.
It's very crucial. I think the parenting was never so challenging as much as now. And
yes,
I practice in two different places. One is in Madhapur, other is Vanasthalipuram. So Vanasthalipuram, I get a very different set of parents and children. In Madhapur, high-tech city, I have a very different kind of children.
Different in the culture, upbringing, like that way. Yeah.
So we should understand that entire privacy thing which we fight. And here, the fight is about some gadget. There, the fight is total about privacy. Then how, without my permission, why did you enter my room? So those kind of things happen in Madhapur.
Correct, sir. So, yes, sir, I would like to conclude with another very, popular topic, I would say, that is gentle parenting that is coming these days. So, still, I think many parents are confused. Like, the parents who are now parenting their kids have been brought up in a different way. Like, the parents were scolded nicely, they were hit by their parents, but still the parents who are now the parents were never disturbed emotionally or mentally. But these days now they are saying that that kind of a behavior should not be done towards the child. There should be gentle parenting. Parents should not scold, parents should not beat the kids. So what would you suggest on this, like how to deal with this thing?
Yeah. So first thing, as a parent, we should all accept that generation is gone. So we cannot use the same parenting styles now. So I think gentle parenting is a very important thing that, like, now onwards, we should think that. So I'll tell you why gentle parenting is needed first. Because previously, suppose if I was hit by my father when I was in 4th standard, 10th standard, when I tell to my friends that my father has tapped me, then you know what my other friends would say? They would laugh at me. You're very lucky. We were beaten by something else. So for us, we never get a message like this, that did your father hit you? How can he do that?
Correct,
I mean, how can this is not? I mean, not acceptable. My
in
parents
some
don't
places,
do that.
yeah, some places even the child can file a case against the parent for hitting. Correct.
Like in US, yeah.
Yes.
So now that the child is getting a different message, that they think it's not at all acceptable. So as a society, we have changed now. So we should understand that the old techniques will not work. Unfortunately, parents either do exactly what their parents did to them, or they do the opposite. For example, they feel that their father is very controlling, we're never connected to them, so they get over connected to the child and over pamper the child. So both are totally unacceptable. So parenting, there are three styles. One is authoritative, which is the best one, and authoritarian, which is more controlling, like what we had in 1990s or 80s, and permissive is what's happening now. Permissive is when the child, whatever the child likes, whatever the child wants, that the child is in the driver's seat, parents are in the back seat. So child will decide what will happen. So that is also not going to help, because they become independent, but the authority and autonomy is very high, but they have difficulty in adjusting with the world where no is heard more than the yes. So they have difficulty in interpersonal relationships. So I think gentle parenting is important, but gentle parenting is not permissive parenting. Gentle is when you listen to your child, understand the child, connect with your child, and also when needed you should discipline the child. Discipline not physically, but by giving a consequence. For example, for their behavior, making them responsible, or by overcorrecting the child. If their child is not listening, then you say, "I'm sorry, I want to give you this, but until you finish that, I'm not going to give this. I'm sorry. Daddy wants to give you. He's ready with the remote, but until you finish your work, I can't give. I'm sorry." So explaining the child in beforehand, not taking quick impulsive decision that I decide, you do it. That will not happen. That will not be helpful. So child should feel like, okay, he should in fact appreciate. He should say that there are a lot of parents who hit, a lot of parents who pamper. I think you are right. That the child himself should say one day that you are right. You always teach me this anger management. You always teach me some discipline. Thank you. Thank you for teaching this. Now, this should not happen later when they grow up. It should happen now. So that parents child should not feel that parents are trying to control them so much. So, but the parent, like this generation, parents have a doubt that if you do this gentle parenting, how will they listen to us?
Correct.
So this is one question. But actually, gentle parenting with consistency and firmness is also important. Gentle is not pampering a child. Yeah.
So firmness without harming the child emotionally or physically, but still putting our point. So
putting
the
our
parents
point across.
Yes, parents have to practice this. So
like if 10% of the time you are firm when needed, like if the child is stubborn, you also be stubborn. You say nothing doing. You finish and then you ask. That time you should be firm. Your face, your body language should not be jovial. At the 90% of the time you are friendly. So the child will not feel offended for the 10 or 20% of the time when you are being firm with them. They will argue, they will bargain, then finally they'll understand your viewpoint.
Right. So the child also should understand that, okay, this time whatever I do, the parent is not going to change. So that way we have to move. So,
and one more thing I want to say is communication. When you're talking to a child, let the child learn first this thing, that sit properly, talk to me, wait when I'm saying something, I'll finish in 1 minute, then you talk, and then when you finish, then I will talk. So they can always question your authority. Let them question, you give the reason. You cannot always say that I said and you do it, nothing doing.
Right.
And because you are saying so many things, you should also follow. So many people don't even know how to talk. Like many families I know, in front of me they fight. I mean, everybody's talking at the same point. So, like you are talking, I'm listening, then I'm saying something, you are listening. This turn taking is also basic. This is a very basic thing in communication. This is absent in many families. That should not happen.
Yes. So I think when the parents take the kid to the psychiatrist, even the parents also need some counseling and therapy.
Yes. I strongly feel parenting disorder is also there. I'm just jokingly saying. Many people don't know. We call children having some problem. The parents also have having some problem. Over expectations, domination.
But unfortunately, in India, we don't have such kind of counselings. I think before, the parents face such problems. I feel there should be some counseling for the parents also. Yes, sir, thank you so much for discussing all these points. So yes,
Thank you
friends,
so much.
as discussed with doctor, so we have so many psychiatrists around us who can evaluate, diagnose and treat psychiatric disorders of the child with various therapies and help children and their parents to manage a broad range of conditions that we have discussed. So like doctor mentioned, he has 2 clinics in Hyderabad, one in Vanasthalipuram and other one, the Little Wings Child Development Center in Madhapur. So I would definitely recommend all of you to visit doctor if you even find slightest of change in your child, because just having one consultation is nothing wrong. We will be assured that okay, the child is good, or if there is any issue or any problem, obviously we have doctor to help us with it. So yes, doctor, thank you so much for coming to my channel, and I hope this podcast is going to be very useful for all the parents. So thank you once again.
It's my pleasure. Thank you so much.
Thank you.